April is Sexual Assault Awareness Month. It's a time to talk about sexual violence, find ways to prevent it, and provide supports for those who need it. Joining us now from Clinic's Hummingbird Program is Ashley Stewart. Good morning, Ashley.
Good morning. Thank you for having me.
Well, thank you for joining us. Now, Clinic has always been there for people when they're struggling with mental health and other issues like sexual violence, but Hummingbird is a new project. It's only a year old, correct. And in 1 year, what have you seen?
So in the past year, we've seen over 700 folks who have come to seek services at Clinic in our Hummingbird program and access some of the things we have available.
So what is Hummingbird?
So Hummingbird is a multidisciplinary program at Clinic Community Health Center where we have advocates who can support people through the process, help them with what their choices are, reporting, sit with them through an exam, through court. We have nurses who are specially trained to care for people, collect forensic evidence, and we have system navigators and cultural support as well who can support people after they've gone through sexual violence or intimate partner violence.
In 1 year, 700 people. Are you surprised by the number?
You know what, I'm not. Having done this work for many years, we know how often it's happening, but not everyone knows where to seek support. So unfortunately, those numbers aren't surprising, and there's probably even more people, but they don't know where to maybe seek services or get support and help.
Before Hummingbird, what were survivors supposed to do?
Often they would usually go to a hospital, an emergency room to get access to medical care, but the counselors and the advocates at Clinic have been there for many, many years.
And I mean, the experience is surrounded in trauma, and then to sit in triage at emergency is not helping the situation at all.
You know, for some folks who want to maybe access services outside a hospital or emergency room, this is why we wanted to develop some community-based care where folks can just walk into a clinic or a setting that might not look like a health center and access supports like the counselors, the nurses, or those advocates.
So for this awareness month, why is it important to talk about this?
It is so important to first of all raise awareness, globally about sexual violence, what that looks like, the lack of consent, and help educate the public as well on how to prevent sexual assault, what services that you can access, and really talk about what we can do as a community as well.
Do people report it when they're survivors of sexual violence?
Many people don't. We know the folks that we're seeing in some of the data we have on police-reported sexual assaults are actually quite low. Many people don't report at all, which is why we want to make sure folks have access to seek help when they want it.
So if someone's watching this right now and they themselves are survivors of sexual violence, but they didn't seek the help, what do you want them to know?
That it's not too late, that at any point they can walk into 167 Sherbrooke or they can give us a call and they can still get that support, whether that be advocacy or counseling or medical care. We can still do that at any point.
You're also having a resource fair tomorrow. Tell us about that.
We are. We're having a resource fair tomorrow, 11 a.m. to 3 p.m. and it's going to be at the Sergeant Tommy Prince Place, which is at 90 St. Clair. And we're going to have a bunch of community resources who will have tables, tell people about the supports. We're going to feed people and just really talk about and raise awareness about topics around sexual assault. And
anyone is welcome to attend?
Anyone can attend.
Anything else you want people to know at home?
I think just how to access us. You can access us by walking in at 167 Sherbrooke Street. You can call our nursing line to also book an appointment or walk in at 451-9445, or our toll-free number, which is 24-hour, is 1-888-292-7565.
Ashley, thank you for sharing this with us.
Thank you for having me.